Hello everyone, my name is Ryan Turnbull, and today we will be talking and explaining a function that dental assistants perform on patients. That function is applying varnishes and fluorides. First, let's go over potential risks with the patient. Let's review their medical history for any contraindications such as food or eye allergies. Next, we're going to move on to the purpose, and there are several purposes. First is to slow mineralization and boost remineralization, thus preventing infection, pain, and need for fillings or surgical treatment. Also reverses, retards, and arrests process of cavity formation, and it also strengthens enamel. Next, we have the contraindications. Children with a low risk of cavity formation who consume optimally fluoridated water, or children who receive routine fluoride treatments through a dental office. Other contraindications include ulcerative gingivitis and stomatitis, known allergies or reactions to colonophony, avoid ingestions during application, not to be used as a systemic treatment. Now, before we move on to the steps, explain to the patient what exactly we'll be doing. So simply just tell them that we'll be applying the fluoride, and the fluoride is meant to stay on for 6 hours. It's painted on the tooth, and it'll naturally wear off. Now let's get back to the steps. So we're going to have and with the steps, I had help from Jennifer Suminski, a YouTuber, and her video was how to apply fluoride varnish. So we have the applicator packet, and in the applicator packet, it'll look similar to this, obviously not in paper, but it'll be actually a packet, and it'll have the fluoride right here, indicated in blue, and we'll have the brush in red. So next, we're gonna move the patient into a supine position, which means that they'll be laying down and their face and torso will be upwards. If the teeth are sensitive, we'll apply gauze to dry off the teeth, or we'll use this water air syringe tip, which looks like this straw with a handle on it. And so we're going to start with the maxillary arch first. Got the skin peeled back, and we're simply going to dry the teeth off. Then we're going to move on to the mandible. Do the same thing like we did in the maxillary arch. And then next, we're going to take our brush, first let's talk about this brush. So this yellow rubber band part is going to be our notch, and this brush is going to have a notch, and it's going to allow for greater extension within the teeth. So we're going to let's apply the fluoride now, and we're going to start with the mandible first. That way it'll activate the salivary glands, and let's get all the surfaces. So let's get the buccal, get those facials, get the occlusal on top, and get the lingual near the tongue. Then we're going to move on to the maxillary arch. Pretty simple. Again, get all those surfaces. Get the buccal, the labial, the occlusal, which again is the top of the teeth, the lingual near the tongue. And if they do have fluoride on their tongue, you can wipe it off with gauze. Now let's go on to the precautions. It's not to be used as a systemic treatment. It's simple and safe treatment. Hardly any fluoride is swallowed during the treatment, and it's quickly applied and hardens. Usually the worst thing that occurs is that the teeth may appear yellow, but that goes away. Patient post-op instructions is next. So you're going to want to explain that if they have let's say they get this treatment done in the morning, they can brush their teeth at night. Now, if it's an afternoon appointment or a late evening, you're going to want to wait until the next day to brush and floss your teeth. You're going to want to advise them to wait 30 minutes to eat any food or drinks. This allows for the fluoride to be absorbed into the teeth. Follow-up visits should occur 3, 6 months, and 12 months. Avoid crunchy and hot drinks, 4 to 6 hours at least, or until the next day. Also want to avoid brushing and flossing 4 to 6 hours as well, or until the next day. And it is advisable to drink through a straw. Remove excess traces of fluoride the next day with toothbrush and floss. Lastly, we have supervision for DA. Under this function, we are under the term general supervision, which means we can take instructions from a licensed dentist, but we do not need to be under direct supervision. So we can perform this as one of our expanded functions and not have to be under the direct supervision of the dentist. And this is great. This allows for more roles, more responsibility, and it, it, it gives us more worth on the dental team. So that concludes my presentation on how to apply fluoride and varnish. Thank you.